A lot of people are still asking me a lot of questions about this Medicare insurance, supplemental, advantage. What is the difference? Some of you are already knowledgeable. In fact, you are already enrolled in one plan or another, either supplemental or advantage. But some people are still struggling with this. Well, it took me 2 years to finally understand what this is all about. That's what we'll talk about. Stay with me. The most serious question we ask ourselves is, well, I'm retired, I have Medicare, am I covered for everything? No? Do I need to get supplemental and advantage? What is the difference between the two? So first, I'm going to give you the background information, and then we'll talk about what you need to be very careful about in choosing the Advantage plan, which is the subject matter of our video. So first, let's look at the background information. Original Medicare. That is the basic Medicare that the government provides you. It's in two parts. First, there's so-called Part A, which covers you for hospitalization. That is mandatory. Once you hit the age of 65, you automatically get that. But don't worry, it's free. You don't pay for it. Now, what do you do when you get hospitalized? There should be a doctor who's paying attention to you, right? They need to get paid. Well, you need to have Part B, which is for doctor's fees. That one is optional, and you pay about $150 approximately for each person. It could differ depending on your situation, but most of the time it's about $150 per person. Now, I say it's optional, so if you're going to the Philippines or going overseas and you don't plan to come back, don't enroll in Part B, so you will get a little bit more of your Social Security, because that amount gets deducted from your Social Security check. Part A, on the other hand, you don't have to worry about because you're not paying for it, and it's mandatory, so leave it alone. It costs you nothing. However, here is the kicker. Even though you're covered for Part A and B, you're only covered on the original Medicare, you're only covered for up to 80% of the cost. So if you spend $10,000 on hospitalization and doctor's fees, only $8,000 will be paid. You're still responsible for the $2,000. Well, who wants that? So for most people, they have to get something to fill the gap. There are two kinds. You can get at your cost, either a supplemental plan that is more expensive and more comprehensive. What the plan says is, when you get hospitalized, let's say cost is $10,000, you submit everything to the insurance company. They will take care of collecting the $8,000 from Social Security. They will collect that from Social Security. Then they will be responsible for paying the $2,000. And that's why it's called the gap insurance. It insures you for the gap that is not covered by Medicare. But as you can see, Medicare is still on the hook for the $8,000. That is supplemental plan. Now, that's more expensive and more comprehensive. You can be any part of the United States. You could be in California, in Washington, you could be in Connecticut, Idaho, anywhere, and you will be covered. Nothing to worry about. What's the other kind? Oh, by the way, that does not include prescription plan. So in addition to paying for the supplemental plan, you also have to get prescription, which could range anywhere from $10 to $50 a month, something like that, depending on the kind of prescription you get. Advantage plan, on the other hand, usually free or much cheaper, maybe up to $40, $50 a month. Okay, on the supplemental plan, it could cost you anywhere from $100 to $200 a month. Okay, and that is in addition to the Part B, because in both cases, whether you have supplemental or advantage plan, you have to have Part B. Because remember that to get a supplemental plan company, gets the 80% from Medicare. So they require that you pay the 80%, the $150 or so on Part B, so that you're fully insured on Medicare, original Medicare, before you can get a supplemental plan. But on the supplemental plan, you have to get your own prescription plan. Advantage plan is free. There are plans that are free and a small amount. They offer different kinds of, let's say you have less deductible, you want less copay, you want a little bit more coverage here and there, and that will be the Advantage plan with some small amount of premium. Maybe you pay anywhere from $20 to $50 a month, which is much less compared to supplemental. But you must belong to a group like HMO. Meaning if you are in California, you have to have a group there, because that is who will take care of your medical needs. You have to have a hospital, you have to have a set of doctors, because if you are out of town, you're not covered. It's not like supplemental plan, but you will be covered for emergency services. So if you get sick, you cannot go and see a doctor. You have to go to the emergency room. It usually includes prescription coverage, the Advantage plan. And like what I said, the main attraction to Advantage plan is it's much cheaper. Most old people, elderlies, stay at home, stay in one place, just go around the vicinity, so they can go ahead and just maintain a medical facility within their area. It's like an HMO. But if you go travel, if you only travel once in a while, it's okay, because you don't expect to be sick. And if you get sick on emergency, you go to the emergency room, then you will be covered. I believe up to 80% only on emergency coverage. Now, as I said earlier, in both cases, whether you're getting supplemental or Advantage, you have to have Part B. So that's $150. Then on top of that, you either get for Advantage free or small, or a large amount for supplemental. So you will have to add $150 to this supplemental or Advantage if you're paying anything on the Advantage plan. Okay? Now, let me tell you what the difference is. As I explained before, in the supplemental plan, Medicare is still on the hook. They will collect the $8,000 from Medicare, and they will only pay the 20%, only the gap, the one that is not covered. On the Advantage plan, this is how it works. On the Advantage plan, they are responsible for the entire amount. Meanwhile, they collect the premium from Medicare. So let's say Medicare says to them, okay, I'll pay $1,000 a month, whether this guy gets sick or not, you will get $1,000 a month. That's Medicare paying the Advantage plan company $1,000 a month. And then the Advantage plan company will be responsible for your health situation. If you don't get sick, they have $1,000 in their pocket. If you get sick and it costs $1 million, they will be responsible. Now, in both supplemental and Advantage, the only requirement is that they have minimum coverage similar to Medicare. But they could offer more. They could offer more coverage, but not less coverage than what original Medicare would offer. Okay? So, now let's talk about the Advantage plan. Why is it so advantageous? Well, as I mentioned, low premium, that's very attractive to everybody. $0 to $50 maybe. They offer perks. For example, they will throw in dental coverage, so you can have your dental cleaning and such for free. They offer vision coverage, so you can have your eyeglasses, your eyes checked and order your glasses and you get credit for it. You could have hearing aids. Now, this is not on all plans, okay? So you have to check each individual plan. Then you also get gym membership like silver sneakers, and that's what, about $10 a month that you get. And lately I just found out, I don't know if this existed before and I did not know about it, or this is a new incentive that they put in. You get exercise incentive. Oh, what is that exercise incentive? Well, they pay you up to $10 a month if you exercise at least 8 days a week. 8 days a month, that's $5, or 16 days a month, that's $10. If you exercise more than that, you're limited to 10. That's the so-called exercise incentive. Again, that is not necessarily available in all Advantage plans. You'll have to look. They also give you, in the case of the plan that I have, over-the-counter drug allowance. I think we get $50 a quarter that we can spend on aspirin, non-prescription drugs. That is separate from prescription coverage. These are over-the-counter stuff that we can order from the company. Also, Medicare does not have worldwide coverage, but in the case of Advantage plan, they offer worldwide coverage. Now, in the case of supplemental, they may give you worldwide coverage, but temporarily, only if you're traveling overseas. They may only give you coverage for 60 days or maybe 90 days at the most. In the event you are out traveling, after 90 days or 60 days, you're out of luck. You're no longer covered in the supplemental. The Advantage gives you worldwide coverage. Now, here's the thing that we are supposed to discuss. Disadvantages of the Advantage plan. As I said before, you need to belong to a network, HMO or PPO. They may require referral. In the case of Pennsylvania, state law says HMOs cannot require referral. So in that case, there is no difference between PPO and HMO. But in PPO, you may have a little bit more selectivity in terms of which doctor you want, which hospital you want. HMO, you are committed to staying within the network. That is a major one. When you're selecting the Advantage plan, you will tell them who your doctors are, what medicines you have, and they have it all on computer, and they will tell you which plan I think is best for you. They will tell you, oh, Humana will be good, United Health will be better, and so forth and so on. They have a list of all the companies, so you have to check with a Advantage plan consultant. I use eHealth. I check with them on what is best for me on the Advantage plan. Now, sometimes you need certification. My wife had a surgery before, and I needed to get an approval. Remember, supplemental, you can go anywhere you want and you'll be covered, okay? But here you need certification. And then at first they were asking her to go to a hospital in Philadelphia, which is further out from where I live, and we were complaining. And finally they found someone locally, and they allowed us, they approved the procedure to be done there, in that local hospital. So it requires certification. Sometimes it's an inconvenience and could be very annoying. Now, if you switch back, there is no problem you going from supplemental. Let's say you had Medicare and you first took supplemental. If you took supplemental and you want to change over to an Advantage plan, there is no problem. But going from Advantage plan, you want to go back to supplemental, it may require underwriting. So if you have a condition, let's say, and let's say you didn't have a condition when you retired, and you were on regional Medicare, and you said, I will get Advantage plan. And then at some point later, maybe 2, 3, 4 years down the road, you started having a heart attack, or you needed, let's say they require you to have a dialysis, if you have diabetes and such. That could be very expensive. And then you say, gee, I want to switch back to supplemental. At that point, it may be too late. You may not be able to get back to supplemental because it will require underwriting. If you have any major illness, heart attack, things like that, you have been hospitalized or frequently hospitalized, They will investigate that, and if you had those conditions, they will not allow you to switch back. They'll say, no, you have to stay where you are, so you may get stuck. One thing good about the Advantage, they usually give you, to minimize the risk on your part, a total out-of-pocket cost to you. For example, you may be responsible for certain things and it could cost you thousands of dollars, okay? But they cannot require you to spend more than, for example, $6,000. I think in my case it's $6,000 per calendar year, okay? $6,000 for me. So you have to have that emergency money in the event you had serious illness. You have money to pull out to cover for that. But it's limited to a certain amount. Your plan may be $4,000, $5,000, $8,000. It depends. So check on the plan that you're looking at. In my case, it's $6,000 maximum per calendar year. That's the most I have to pay. And so far, I have not spent more than things I have to pay myself, probably more than $400, $500 a year. That's it. Whereas you'll be paying $200 on a supplemental premium every month. So I'm saving a lot. But my situation could change in the future and I can get stuck. That's a problem. The other thing too is there is usually an open enrollment period, they call it, from October 15 to December 7. So right now is open enrollment. That is when you can make changes. Let's say if you don't like the insurance company you have now, you check with the consultant and you reviewed your prescriptions and your doctors, and they might say, oh, this one will be better for you. This is the time period for you to make a change. Now, in my case, for example, I have HMO, so they did look at the PPO for me, and they said, oh, you are going to lose one doctor. So one doctor does not belong to that PPO plan, and therefore I will be forced to make a change. I think it's the cardiologist. I'll be forced to make a change. And also, given the small amount of benefit, you're better off staying where you are, staying with the HMO plan. So I do have an HMO Advantage plan. I don't have any major serious illness. The thing that scares me in the future, potentially, is heart attack, heart condition, congestive heart failure, or maybe dialysis because I have diabetes. So those are risks I'm willing to take. But the major advantage to me is, in addition to no premium I have to pay, when I go overseas, because I plan to spend 50% of my time in the Philippines and some other Asian countries, I will be covered in the Advantage plan but not on the supplemental. The risk for me now is I will be visiting my son and my daughter between Washington and Connecticut. If I'm, for example, if I transfer my enrollment from Pennsylvania to Washington, meaning that's going to be my registered address, if I'm Connecticut, I will only be covered for emergency and maybe only up to 80%. So that's going to be a risk. So when the time comes that I get sickly, I'll probably opt to not travel as much as I want to. Okay, so that is the basic difference, but you have to be very, very careful. See, when you go to supplemental, there is no risk other than you paying a lot of money. But when you go Advantage, you get all those advantages, the perks, no premium or low premium, but you have to be very careful about the potential in the future. Do you think it will happen to you? So would you rather be sure and stay and pay the higher premium on a supplemental program or a plan? Now, the basic difference, major difference between the two is supplemental only is responsible for the 20%, and the Medicare, original Medicare, is still on the hook. Whereas on the Advantage plan, the insurance company is responsible for everything. That's it. Medicare is out. Medicare is out. Now, they're still in that they will collect the Part B premium because they have to collect that from you because they're paying it out to the Advantage plan company. All right. So hopefully this explains everything in a nutshell. It's a little bit confusing, so you may want to watch this video several times if you have an appointment with an agent for you to understand fully what's going on. Oh, one more very important thing. In selecting the Advantage Plan, make sure you select a company that has a lot of doctors, not a company that just started and they only have select doctors, because you may have a problem. If you need a specialist, you may have to go elsewhere. Okay? So make sure you get one with a lot of doctors. Also, make sure you have one that has a lot of participants in it. They already have a lot of insured, because a company that has a small number of insured is likely to drop the plan or raise the premium because they need to make money. And you can only make money by having a lot of insured people. If you only have 2 or 3, they're not going to have the plan. Okay? And so those are the two things. Now, Advantage Plan is really good in big cities like Philadelphia, but not in rural, because in rural areas there are very few participants and very few service providers. So it usually doesn't work in that case. So hopefully this information helps you out, and feel free to ask me questions if you want, and I will try to answer it to the extent that I can. If I don't know the answer, sorry, I'm not an insurance agent. I learned this thing over a 2-year period that I researched it before I retired and made my choice. Thank you very much for watching. Please do share this with other people, and I'll appreciate it if you can click like, and do subscribe to my channel unless you have already done so, and please click the notification bell so you get notified of new videos that I am posting. God bless, and make it a great day.